to today's live streaming. I'm Dr. Thompson, one of the doctor. I'm Dr. Thompson, the instructor of the T-Square OET Academy. You are all welcome to today's live streaming. All right, guys. Today I will want to address some questions that most candidates commonly ask about OET reading and OET writing. If you have any question, you can drop them in the comment section and I will be glad to answer all your questions. All right, guys. All right, guys. Sometimes some students usually are confused about OET reading. Okay, and they usually ask like, how many questions do you have in OET reading? In your exam, for OET exams, for OET reading, you have 42 questions in total, and these questions are divided into two parts. The first paper will be given to you, which will contain part 20 questions. That's the part A. And then you are given 15 minutes to answer these 20 questions. And also you have part B and part C as one question, and you are given 45 minutes to answer these questions. Okay, so for part A, where you have 20 questions to run in 15 minutes, it's actually quite difficult to deal with such questions. Usually I advise my students to develop a technique or a skill that can help them to go through that part, because it's actually tough going through 20 questions in just 15 minutes. Okay, so what I advise is this: the commonest method or the commonest strategy that most students use is this. It's actually advisable to start from question number 7 or 8, as the case may be, and first of all leave out the matching questions, okay, and start from question number 7 or 8 and then run through to question number 20. While doing this, you will be able to master the question and then understand the whole passage before you go back to parts. Before you go back to question number 1 to 7, because the question number 1 to 7 they are usually matching questions. So a piece of information is given and you are asked to find out where this piece of information is taken from. Is it section A? Is it section B, section C, or section or section D? Because you actually have 4 extracts in the reading. Okay, you have 4 extracts in the reading, and these extracts are short texts, so they are grouped into part A, B, C, and D. Okay, so and you are given the 20 questions to run through. So from the first question to like question number 5, 6, or 7, these questions are usually matching questions. So if you start your part A from these matching questions, you will find it very difficult to finish the questions, because it will now warrant you to start reading to understand the text, so that you know where that piece of information is actually gotten from, and you keep wasting time. Because if you look at the whole exam, you just have 15 minutes for 20 questions, meaning you don't have up to a minute for a question, so you have lesser time to answer your questions. So you have to develop any strategy possible that will help you to be very fast in that part A. What they are all looking for in part A is the speed. Okay, is your speed in answering these questions, and the answers are quite easy to fetch out to get. Okay, so after answering to question number 20, then you can come back to question number 1 to question number 7 to answer. And another thing I will advise is this: there is always this temptation while answering these questions when you are stuck in a particular question, you'll be tempted to, oh, let me get this question before I move on. Remember, you are there in the exam just to pass the exam, not to impress anyone. So, and each question, all the questions, they all have equal mark. So why waste a lot of time on just one question? So any question that proves difficult, leave the question and move on. Okay, if you start, let's say you started from question number 8, and question number 8 you cannot find the answer in 20 seconds, leave it and move on to question number 8, then to question number 9, and when you go to question number 9 and you're also finding it difficult to get the answer, leave it and move on to question number 10. There is something very unique about OET reading. Sometimes as you are moving on, the question that you missed, the answers that you missed before, you can actually get those answers and then fix them up. Unlike if you are stuck in a particular question, then it will be very difficult for you to answer other simpler questions that you would have just answered on a normal day. So that's the trick that I would suggest for you guys for part A, because when I wrote that exam, it was really tough for me in part A. Although some persons say part B and part C, they are more difficult. Well, to me, I found part B and part C to be easier because, I don't know, maybe because I'm used to analyzing difficult things, and if given the time, I can actually work on it. But for part A, that speed, I don't actually read very fast. But with practice, I was able to at least get up to 19 out of the 20 questions in part A. Okay, so if you have any question, you have anything confusing you, you can drop them in the chat box, and I'll answer your question as we proceed. All right. Some other students, they be asking me this question in the re-exam. Is the reading tougher than what you have with the practice materials? Well, I think, to me, I would say no. Why would I say something like that? The truth is that because you are practicing, you've encountered tougher reading text and all that. So when you get to OET exam, and the reading text is given to you, to some extent it appears a little easier compared to the practice material. And I think is actually, to some extent, it's actually true. In the real exam, both the practice material for reading, the practice materials for writing, I think most times they are tougher than what you have in the exam. But it's good to practice with these materials because they are out there to help you. For example, those that wrote their exam today, like in the writing part, they said they just had only 2 visits. Whereas in the practicing materials, most time you have like 3 visits, 4 visits, and thereabouts. Okay, although occasionally you still have those tough questions like that in OET, but most time the practice materials are to some extent tougher than what you have in the exam. But it's actually good that way, that you use those tough practicing materials. Okay. Now, I've also received some persons also have been asking me questions on the reading. I've been receiving these questions. Some person will ask, like, how many out of the 42 questions, how many will I get to pass the exam? Well, it's quite simple. It's actually advisable to try as much as possible to get 30 out of the 42 questions that you are given. Because let's say those that wrote their exam today and those that will write, let's say in the next 2 weeks, the same cutoff mark, their cutoff marks might not be the same. But to be on a safer side, most times if you can get up to 350, up to 30 questions out of the 42 questions, the cutoff marks, they are usually within that range, that 30, 29, 31, 30, 20. So it's always advisable to get at least 30 out of the 42 questions. You will be sure of getting 350, the cutoff mark. Okay. Now, some other persons, they'll be asking me this question. If I make mistakes in the spelling, in the reading material, during the exam, will I be marked down? Now, in OET reading, you are expected to spell your answers correctly. Okay, unlike in the listening you might hear some things, maybe a name of a drug that you've not heard before, and you spelt it and the spelling wasn't correct. In that case, if they look at what you spelt and it's similar to what you listened to, it's similar to the answer, they will give you your full mark. But the same thing is not obtainable in reading. Okay, if you misspell the answer, let's say the answer is paracetamol, and you want to spell paracetamol, instead of writing M-O-L at the end, you wrote M-O-L-E. That's wrong spelling for paracetamol. You will be marked down because they expect that you should be able to lift the answer from the reading text to the answer booklet. Other students have also asked, is it possible for one to use maybe you are supposed to spell, let's say, something like edema, and in the text, what is written in the text is OEDEMA. That's the answer in the text, and in your answer you wrote EDEMA. Such spellings are acceptable, whether you use the US spelling or you use the US spelling or you use the British spelling. Both spellings are acceptable. For those, if you are just joining us, if you have any question, you have anything you want me to answer, you can drop them in the chat box. We'll answer all your questions. Okay. All right. So that's for reading. Now, some persons, they've asked me these questions. How long should I practice that will be enough for me to go for the exam? Well, the answer is not a straight answer because we all differ in the way we comprehend and in the way we read. But generally, if you give yourself consistent practice for 2 months, whether you're an average reader or a slow reader, 2-3 months will be okay. But for fast reader, if you can practice within 3 weeks to one month, you should be able to go to the exam and come out successfully if you're already good in reading. Okay. Now, I'm still on reading part of the exam. Now, we are done. If you have questions in reading part A, you can still ask me. Now, after the reading part A, your answer booklets and the reading text, they are taken from you. You won't have access to them. So that means the first part of the exam is gone. The second part of the exam will now be reading part B and reading part C. And for reading part B and reading part B, you are given these questions in one answer booklet. Okay, you are given in one answer booklet, and when the questions are given to you, you have just 45 minutes to complete these questions. So for an average reader or slow readers, I will always advise, instead of you starting from reading part B, it's advisable to start from reading part C. Okay, Chimobi Wamba is asking, what practice test can one have that will be similar to the real exam questions? Well, there are a lot of practice materials out there. That you can actually use. Although some of them are a little far simpler, and some other ones are more difficult than the real exam. What I advise people is this: it's better to first of all try and download those reading texts on OET website. You have like a 3 sample or 4 sample tests on their website. You can download those sample texts on their website, and first of all read them and assess yourself and see what score you can get from those reading texts. Because the reading text on their website, it's exactly the reading text, it is the same difficulty that the real exam will also have. So use that one first. When you now use that one, there are other reading texts that I also recommend. Like there is this material, authentic reading material that is circulating on Telegram and other platforms. You can download that reading text too. Someone is asking, is Json collection similar to the real text? Well, I've not used Json collection before, but what I can get from my students, they always recommend that the Json reading text is also good. So just try as much as possible. Unlike in IELTS that you have organized reading text, that you have a Cambridge 1, Cambridge 2, Cambridge 3, Cambridge 4, such material, you don't have such in OET. So there are, in 2019, when OET first came in Nigeria, we were even scouting for reading materials to use. But now there are a lot of reading materials out there, both on the one on their website. There are some apps too that you can also download some reading materials. And this Json collection, and especially this authentic OET reading material, that's the one that I used. That's exactly how the difficulty of the exam is the same with that authentic OET reading and text. There are other reading texts there. As much as you can lay your hand on, just use them. But when you compare them with the exam, with the one on their website, you will not decide, is this actually close to one on their website? Okay. For the Kaplan text is a little bit difficult, but there is this Kaplan preparation text that is also similar to what is obtainable in the real exam. So at much reading text that you can get, you can make use of them and practice with them. The real thing is for you to get that, to develop that skill. The mistake that some students make is this: they try as much as possible to be practicing reading text. They are not trying to develop the skill required for the exam. Okay, like this reading part A that I talked about, the skill required in the exam is speed. And for you to get that speed, to finish reading that 15 minutes, if you can try the method that I just told you, starting from question number 8 to question number 20, and then coming back to question number 1, it will also help. Some other students have also said that starting from question number 20 and then be moving back, it's also good. You can also try it out. Do you get? So that this method work for Mr. A does not mean it will also work for Mr. B. But majority of the cases, the approach of starting from question number 8 down and then going back to question number 1 will always help. If you are just joining us, you are welcome to this live stream. And if you have any question, you can ask, you can drop your questions and I will address them here, okay? All right, so I was talking about the reading part B and reading part C. So when they are given to you, I always recommend that you start answering your question from reading part C. Why did I say that? Because in reading part C, you have 8 questions for the first reading text and 8 questions for the second reading text, okay? And remember, you are trying to get 30, at least 30 out of 42. Well, I know some of you that are going for foundation. For those doctors, maybe you want to apply in UK as foundation year 1, you'll be looking at for 400 score in your own case. But majority of persons, they are just looking for 350, and the 350 is just 30 out of 42. So why waste your time unnecessarily trying to start from reading text B, where you just have 6 questions, whereas in reading part C, you have 8 plus 8, that's 16. So out of that 16, if you can get 10 out of the 16 and add to your part A, which is where you have 20 marks, that means you've already gotten the required score to pass. That's why I always advise my students in my academy to always work very hard to make sure they get 20 over 20 in part A, because with that you will be able to, the probability of you passing that exam will be very high if you can get 20 over 20 in part A reading. That means you are just looking for 10. So when that part B and part C is given to you, the next thing to do is just go straight to part C first. And one good thing about part C is that the OET, they always tell you where the answer will be. Sometimes they would, in the question, they will say in first paragraph or in third paragraph, in second paragraph. So they will just direct you to where the question will be. Another mistake that some students make is this: they waste their time trying to read the whole text before they start answering questions. To be honest with you, if you are doing that, you are just wasting your time, because you would have spent 5 minutes or 10 minutes trying to read the whole text, which does not have any additional benefits, to be honest with you. So just try to know the title, go to the question, go to paragraph number 1, answer the question, and come back and go back to the question, just like that, and progress sequentially. The answers are arranged sequentially. So if you've gotten your answer, maybe answer to question number 7 in paragraph 1, most likely the answer to question number 8 will be coming from paragraph 2. And if you've gotten your answer from question number 8 from paragraph 2, most likely the answer to question number 9 will be coming from the later part of paragraph 2 or in paragraph 3. So the answers are arranged sequentially. So no need trying to read the whole text before you start answering the question. Remember, you have 2 long texts there. So you should also try your best to maximize your time. Now, some persons usually ask, sometimes I read these questions and the questions, the answers, they all appear to be correct. Yeah, in OET reading text, the truth is this: in OET reading text, the answers you will see there, they all appear to be correct, because what they are looking for from the answer is for you to pick the best option. Okay, to pick the best option. And how do you do that? For instance, let's say in the reading text, they said Mr. Jones presented with a fever, cough, and a sore throat. That's what, and the question is now, the question is now asking, what are the clinical features that Mr. Jones presented with? Now, in the text, if you go back to the text, and you are, okay, let me take this one first. In the text, the first answer number A might say, Mr. Jones presented with a fever. That answer is correct. B might also say Mr. Jones presented with a sore throat. That answer is also correct. Then C might now say something like this: Mr. Jones presented with fever, sore throat, and cough. So you can now see that the most correct answer is C. So if you have chosen A, you are wrong. If you have chosen B, you are wrong, because OET is looking for the best option. So you should go for the best option in that part B, especially in part C. Okay. Now another, some students said sometimes they look at the questions and they will be looking for the word in the text and they will not see the words. To be honest with you, if you are looking for the same word in the question paper in the answer, you cannot get it. If any answer that you see, that the word you are seeing is exactly the same with the text. Maybe you go to the text says, Mr. Jones presents with a fever, cough, and a sore throat. And in one of the answer, you are also seeing Mr. A presents with a fever, cough, and a sore throat. To be honest with you, there must be something fishy about that answer. That answer is most likely not the correct answer. Okay? The correct answer, they will most likely paraphrase the word. Maybe they will no longer mention symptoms again. They might say something like clinical features. So you knowing that clinical features is the same thing with symptoms, with signs and symptoms, you will be able to get the answer. So if you see exactly the way the thing, most likely, I can assure you, most likely that is not the answer. All right, if you are just joining us and you have any question to ask, just drop your questions in the comment section and then I will address them. Okay? All right. So after answering part C of the reading text, you will now go back to part B. Now some Chimobi from Nigeria is asking, the questions, are they arranged the answers, which part of the OET reading text or exam is arranged sequentially. It's just only part C that the answers are arranged sequentially. For part A, the answers are not arranged sequentially at all, because some persons they be having that notion. But one good thing about part A, let's say in number 15 or number 14, you got the answer, you saw the answer in reading part text. In reading part B, in reading part, for part A, you have text A, text B, text C, text D. Let's say question number 8 or question number 9, you got the answer in text B. Okay, most likely the answer to question number 10 might also be in text B, but it does not usually follow. But in what I've discovered, in most cases, the answer will also be coming from there. So don't now expect that because you've gotten your question from text B, that no question number 10 will now be coming from text C. It does not follow. The question number 10 might be coming from text A. But for reading part C, it's only in reading part C that the questions are arranged sequentially. So they arrange the question for paragraph 1 and just arrange this question sequentially. Even sometimes they will even tell you, go to paragraph B. That's in reading parts in paragraph C, answer this question. So they will just direct you. You will just go straight to that paragraph. I don't know if there are other questions we want to ask concerning reading before we move to writing. All right. After answering part C, before you go to reading part B, why would I recommend that you go to reading part C first before going to reading part C, or to reading part B, sorry. Reading part C, you have short extracts. Do you get? And it's not really easy reading those short extracts, and the answers in reading part B, they are not also easy to also get. So you need to read, go back to the passage, read again, go back. Do you understand? Before you now finally get it, because the answers can be a little bit tricky. So instead of you wasting a lot of time in that reading part B, just for 6 questions, it's better to go to reading part C, where you have 16 questions that you can get. If you can get 10, 11, 12 out of the 16, and add to your reading part A, where you've already gotten, let's say 20 or 19. If you add it up, you will get at least your 30 marks needed for you to pass the exam. So that's what I would really advise that you guys do. There is no need trying to impress anybody in that exam. What you should be looking at for is how to maximize your time and get at least 30 and pass the exam and move on with your life. Because to be honest, if you are going to the medical line, nursing line, any line you are going through, it's usually for... Okay, thank you very much, Mustafa Aliyu. I really appreciate. They expect to answer using medical. All right, other texts, just as Mohammed just asked, there are some reading texts that can also help you. You can try as much as during the period of your preparation, you can be reading medical journals. It really helps. That's a very nice one. You can be reading medical journal, any medical journal that you can lay your hands on, even some podcasts or some TED Talks on health. Okay, you can also lay your hand. You can even go to BBC, their health section, and read articles from there. It will also help you to familiarize yourself with reading and also develop your reading skill. That's a very nice one, Mustafa. Mohammed, I meant to say. Thank you. Okay, so now when you now finally come to your reading part B, because in part B of the reading text, where you have those short texts, you really just have 6 short texts, and these short texts, to be honest with you, they were to some extent very tough for me, but with practice they become easier to navigate. You just have 3, A, B, and C to select from. All right, Mustafa is also asking, thank you, okay, medical knowledge. Well, If you have a medical knowledge about first of all, OET is designed for medical professionals, doctors, nurses, physiotherapists. Do you get? So to some extent, they make the test that if you are a doctor, if you are a nurse, if you are a pharmacist, any section, any any department, we are call it department, or any profession that you any department that you are, or any parts that you belong to, whether you are a core medicine or pharmacy or nursing, you should be able to understand the text that they bring for you. They don't bring texts that are, will I say, course specific. Let's say for example, bringing text that maybe only a microbiologist will be able to navigate. No, they make those tests. They bring text that even if you're not in that field, you should be able to understand and answer those questions. So picking random materials on health related issues will help you to still develop your skills. Okay, all right guys, if your questions, if I've not still answered your questions, you can still post your questions for me to answer. So for the reading part B, you can now pick those. By the time you are done with A, you are done with C, then you can now relax and deal with the reading and tackle the reading part B. The reading part B, usually the method I adopt was okay. Thank you very much, Aliyu. I really appreciate. Yeah, thank you very much. All right, the method the method that I adopted in part C, because sometimes that part C used to give me a lot of stress. So I now decided to now cone it down to, I have 3 options to select from. Instead of looking for the answer, I try to knock off those that are not the answer, maybe one, and I'll now be left with 2 options to select from. Because those parts B can also be tricky. Sometimes the 3 options, they are all, what you are seeing, they are all in the text. Just a little thing that will just make it different, or not to be the answer, or not to be correct. So if you're not very careful, not very analytical about the text, you won't be able to get it. All right, thank you very much guys. I think we'll stop here for reading. Let's go over to writing. Because these are the 2 major parts that are always challenging for students, both reading and writing. Now for writing, to be honest, I think OET is very, very, will I say, benign per se. They are not too tough compared to other English tests, to be honest, other English tests or testing bodies, to be honest with you. Because you just have only 1 letter to write. And in that 1 letter, they are not too strict with minor errors that you might make. Do you get? So now, let me give you an approach that is generally acceptable, because they want you to be as practical as possible, to be as real as possible. In the UK, in the US, Australia, and in the developed world, there is this approach that they normally follow that help them to, when they are writing referral letters, transfer letters, discharge letters, they try as much as possible to follow this approach in order to be able to sieve out relevant information necessary for writing, and also relevant information that they will include, so that they will not miss out information that they think they are not relevant. Okay. And this approach, what they usually do is this: they try as much as possible to write the introduction and discuss, after writing the introduction, and discuss the situation. What do I mean by the situation? In the case note given to you, what is the problem in that case note? What's the issue you are resolving in that case note? The why in the case note, that's the problem there. Maybe in the case notes, maybe the patient has visited 3 times and has been battling with depression. So depression is the situation in that case note. Now, after the introduction, it's very good to go straight and discuss the situation. Now, after discussing the situation, the next thing that you should include in your letter is to discuss the background of the writing of the patient. After the background, the next thing you make your assessment. Is this patient getting better? Is the condition getting worse? What diagnosis have you made for this patient? Depending on what you are writing on, okay. Then after the assessment, you will now go ahead and discuss the recommendation or your request. You make your request and your recommendation. Now, whether you are writing a transfer letter, you are writing a discharge letter, you are writing a referral letter, these 5 things should always be in your letter. Okay, they should always be in your letter, and I call it you can use this acronym ISBAR. ISBAR. Now, the sequence of this ISBAR does not usually follow. Sometimes after the introduction, the background will come first before the situation. Okay, and sometimes the background might be coming after your assessment. For example, in discharge letters, where you first of all discuss the introduction, discuss the situation, what you manage the patient for, discuss the patient's progress, then you can decide to bring in your background there, or your background can come before your situation. So there is a little bit flexibility depending on who you are writing to and what you want the reader to do for you. Okay, I don't know if you have any questions so far on writing. All right, now in the introduction, what are you supposed to include in your introduction is very important. It is always good for you to introduce your patient by calling the patient his or her name. Okay, by calling the patient his or her name. After introducing the patient, it's also good, or okay, if possible, for you to introduce yourself as a nurse, a pharmacist, a GP, okay, a charge nurse, a registered nurse in the introduction, if possible. But sometimes it might not be possible for you to introduce yourself in the introduction, but sometimes it's actually possible to do that. So you can introduce yourself in the introduction. Then the next thing is to introduce the situation. What is the situation you are managing the patient for? The clinical signs and your investigation findings, what are they pointing to? Are they pointing to schizophrenia? Are they pointing to ulcer? So you should be able to introduce the situation in your introduction. Now, after introducing the situation, it's also good when possible, especially in discharge letters, to introduce the patient's progress. Has the patient made some remarkable improvement? Is the patient deteriorating? Okay, you should be able to also introduce the progress that the patient has made. And finally, you should be able to make your request or your recommendation. Okay, what are your recommendations? Maybe in a referral letter, you want the reader to further evaluate this patient and manage this patient. In a discharge letter, the recommendation paragraph is usually very long. You might, in this case, want to, okay, we are still in the introduction, so you should be able to still make your recommendation in that introduction, but you summarize it. Maybe you want the reader to monitor and further manage this patient. Now, these are the things that must be in your introduction. That means your introduction is summarizing the ISBAR. Okay, now after the introduction, you go to the situation. Now, usually the situation can be current situation or previous situation, and the previous situation usually leads to the current situation. What do I mean by current situation and previous situation? Let's take, for instance, a patient that you are being assessed or evaluated for, let's say, diabetes, and this patient came a week ago, 2 weeks ago. So the 2 weeks ago and a week ago, that previous situation, and the patient is now presenting today, which is the current situation. You get? So it's always very advisable that you make your paragraph for the previous situation and also make your paragraph, you summarize the previous situation and also make a paragraph for the current situation. Now, what now determines whether the current situation will come first or the previous situation will come first? It depends on the type of letter. If you are writing an urgent letter, it will be very unreasonable, a very poor organization for you to start your situation from the previous situation where the illness first started. Maybe the illness started, let's say, a month ago, a year ago. That would be bad, very poor organization. It will not be right, because in an urgent situation, in an emergency situation, the reader is always is always on his or her toes. I will not have time trying to read, start analyzing things where it all started. So things that happened a day, yesterday, 2 days ago, a week ago, a month ago, they become less relevant to the reader. So it's always very advisable to start from today's event. What happened today? That's the current situation. After you've discussed the current situation, then you can go back to the previous situation to make a summary, not discussing in details. Okay, you now make a summary. So if you go to my YouTube channel, to some of the tutorials I've made, you will really understand this more. Now, after discussing the situation in this case, okay, if it is urgent letter, you start from current situation and move to previous situation. If it is a cold case, you are not writing to an emergency, the patient is not getting admitted right away. They didn't specify that the case note, the situation is urgent. It's advisable to start from the previous situation. Build your case where the event first started to where you are now. All right. After the situation, then you can move on to the patient's background information. Now, when we talk about patient background information, some students, they are a little bit confused about this. Patient background information includes the medical history, maybe past medical history, or other medical condition that the patient has. It includes the medication that the patient is on. It includes the family and social history. It includes allergy history. If there are hobbies or occupation, they are all the background information of this patient. Okay, so it's advisable to include all this information in one paragraph known as your background paragraph, the background information paragraph. Now, organizing this information, because they are a pool of information, medical, family history, social history, organizing them in one paragraph also depends on who you are writing to. Let's assume you are writing to a social worker. A social worker will be more interested in knowing things regarding the patient's regarding the social history, the family, what type of family does the patient has. Do you get? That means this information will come first in your background information before discussing other medical conditions, because that will be less relevant to a social worker. Okay? Similarly, let's say you are writing to a psychiatrist. A psychiatrist might be, the information that a psychiatrist might need, the information that might interest a psychiatrist in the background information might be the social history, because these are usually the risk factors. The family history too, before even discussing the patient's past medical history too. Now, if you are writing to, let's say, a consultant, maybe a gastroenterologist, and you are starting from the family history or the social history in your background information, that would be inappropriate to a gastroenterologist. A gastroenterologist will want to know, are there other abdominal illnesses that this patient has that you will talk about first before saying that the patient smokes or takes alcohol. So these are the way you organize your information in the background information. All right. If you have questions, you can always post your question in the comment section and I will answer your question. Now, after the background information, the next thing you have to now talk about is to make your assessment and recommendation. Usually your assessment and recommendation are in one paragraph. Okay? If it is in a referral letter, but in a discharge letter, you might want to write your assessment on a different paragraph, because the assessment for a discharge letter might be much. The assessment for a discharge letter, usually the progress the patient has made. Maybe the blood, the investigation findings are now normal, the patient can now ambulate, the patient can now do activities of daily living without any support, These are all the patient assessment or the patient progress, though they should be in one paragraph. Whereas if it is a referral letter, the assessment might be that the patient condition is deteriorating. Just this statement might just be your assessment. In a referral letter, your assessment might be that the patient information is worsening, or the patient's schizophrenia has decompensated, might just be your assessment. Now, after the assessment, you will now include your request. What is your request? You would want the reader to further assess, to further review this patient, and then provide adequate or proper treatment for the patient. So this might just be your assessment and recommendation. They will be in one paragraph. Usually in that paragraph, that's where most students usually say in view of the above, in view of the above, in light of the above. Well, a lot of persons are writing that, but you can actually make your writing to be a little different. Instead of always saying in view of the above, in light of the above, just go straight and say something like, I believe Mr. Jones' medical condition is deteriorating, and I would want you to further assess and manage this patient. That's just it. So it's not always you say in view of the above, but if you use it in view of the above, it's not still bad. But I like making my writing to be unique from other candidates. Now, after your recommendation paragraph, your last paragraph will now be, please contact me if you need further clarifications, or please contact me if you need more information about Mr. Jones or something like that. Then your closing remarks, maybe yours sincerely, yours faithfully, as the case may be. Yes, somebody said you want to know whether OET has resumed in Nigeria. Yes, they started their exam last month, 28th of April, and some persons also wrote their exam today. That's wrote their exam today. That's I think today is the 9th or the 8th. Okay, 9th of May. Okay, so I think today is 8th. I'm even confused. I hope I will not be evaluated for dementia. All right, that's fine. OET is back in Nigeria, so if you're in Nigeria and you want to write OET, you can easily apply. I think they have dates now from August 28th, 2021. So if you're even knowing now, that means you're even knowing late. Okay, today is 9th. Thank you very much, Chimobi. Wow. Thank you very much. All right, today is 9th. They are done with their exam now, or only those that still have their speaking, maybe they have their speaking later in the day. Okay, somebody is saying yesterday was the exam. Well, I think in some centers yesterday was exam 8, and in some centers today, because in a year like this, I think once in a while OET usually put their exams on Sundays. So I think you might be wrong, Chimobi. Try to verify. I learned the exam was today. All right, so that's the writing for you. Then I'll be receiving some questions in writing too. Some persons will be asking me if they make mistakes in the address, or maybe with the date, with the ray line, with the greeting. Would there be any problem? Would that reduce my mark? To be honest with you, I will say no, because even if you go to the website, OET, their interest, their focus is usually on the content of the letter, what you wrote. Okay, but that does not mean that you should not write other aspects well, like the address, the closing remarks, and the rest. So the body of the letter, the introduction and the body of the letter, they are the major focus of your assessment, because in the new OET assessment criteria, you have the purpose of the letter. In the purpose of the letter, that's where you open it up with your introduction, and if you don't get it right in your introduction, most likely you won't be able to sustain it in the body of the paragraph and the concluding paragraph, and the concluding or your recommendation paragraph. Okay, so you have the purpose of the letter, and these are the 6 criteria. They score you from 0 to 6. So if you didn't get your purpose right, which you are supposed to state in the introduction very clearly, and sustain it in the body of the letter, and then re-emphasize it in the concluding paragraph. If you don't get the purpose very well, you might have 3/6, you might have 0/6, you might have, just as the case may be. So you should be able to get your purpose clearly. Another criterion they also use is what we call the content. So in the content of the letter, what they included in the case note, is that what you included in your letter, or you are manufacturing things, making assumptions? So don't make assumptions for OET. Try as much as possible to write what is in the case note. Okay. The content that you're also including, are you including it in a medical form, or you are just writing like a politician? So they look out for all those things. And you also get from 0 to 6. Okay. Now, after the content, there is another assessment criterion that they call conciseness and clarity. When we talk about conciseness, that's when they are checking out to see if you have included irrelevant things that the reader will not need. Okay. When we talk about clarity, maybe you are writing to an endocrinologist and there are some blood investigations there, like full blood count, lipid profile, and the rest, and there are values. Instead of you writing those values, you are saying that the blood sugar tests are deranged. In that case, you are not being very clear, but because you are writing for this endocrinologist to make an assessment, so you should be able to bring in those values in your writing and state those values. You might not state, maybe let's say lipid profile to an endocrinologist now for assessment of diabetes. You might not state maybe the different components of the lipid profile, like the cholesterol and the rest, but at least you should be able to state the random blood sugar, the value, the glycated hemoglobin, the value, the fasting blood sugar, the value. You should make it very clear. Do you get? So try as much as possible to be very clear, so that because you are writing this, the letter you are writing, the reader will not have the case note given to you. So you should be able to spell out things very clearly for the reader to understand what you are writing. Another criterion they use is your organization and your layout. So in the layout, it's just you leaving a line paragraph. If you write date, if you write the address, leave a line. Write date, leave a line. Write greeting, leave a line. Write the real line, leave a line. Write the after the real line, that's the heading, you leave a line. Before you start your introduction, after introduction, you leave a line. Before you write the situation, after the situation, leave a line. Before you write the background, after the background, leave a line. Before your assessment and recommendation. So whenever you are making a paragraph, for each paragraph, you always leave a line. Punctuations, that's where students also have a lot of problems. Sometimes they use comma where comma is not supposed to be. They use a semicolon where semicolon is not supposed to be. They use a colon. They mix up these punctuations. So I think you should also learn how to punctuate appropriately, because they look at for this, how you use your linking devices. In OET, most of the time, you don't even need more of these linking devices like you use in IELTS. Some might be using linking devices like moreover, furthermore. To be honest, all these linking devices, they are not really necessary in your writing. Okay? Most time, the writing naturally links itself. So only use it when they are appropriate. Once somebody is asking, please, Chimobi is asking, how many paragraphs should OET body paragraphs have? There's no fast and hard rule about how many paragraphs you will have. But from what I've seen so far from my assessment and all that from my academy, most time you might have like 4, 5, 6, 7 as the case may be. There is no really hard and fast rule. The major thing is for you to organize your information the way the reader will understand. So I will not say it's 5 that is the gold standard. It's 6 that is the gold standard. There is no any gold standard in your writing. So you can have any number of paragraphs as long as the flow of information and the sequence of events, they are in order and they are well organized. Like for me now, in the background information, I will always advise to put everything in one paragraph and then organize it according to the importance to the reader. Okay? Alright, I wish you guys the very best. There are no other questions to address, but if you still have further questions, you can still post them on the comment section. I think we'll end this session here. Once in a while, I will also come up with this session in case you have anything confusing us. Anytime you have questions, you can always ask your questions. And there is this section in my YouTube channel, the community section. Every day I do release quiz that will help you. The errors that I've been seeing people make in writing, I bring them forward to my community section. So always visit the community section every day to answer this question. There are a lot of questions there that will help you to improve your writing. Okay, and anytime you have any question to ask, you can go to the community question in the community section of my YouTube channel and drop your questions there. Well, I'm the instructor, I'm Dr. Thompson, once again, the instructor of the T-Square OET Academy. If you have not subscribed to my YouTube, I will advise you to do that. There are a lot of useful tutorials on my YouTube channel. You can go through them. And if you want your letter to be assessed, or you want your speaking to be assessed, you can always contact me for just a small token that you pay, and I will walk you through your exam. Mustafa just asked, is it only referral letter you have in for doctors? No, you don't have only referral letter. But to be honest, most of their questions, they are all referral letter. I think since this year, it's only one discharge letter that has come out from the questions so far. So most of the questions for doctors, they are referral letters. It's in nursing that you have sometimes discharge letter, but most of their questions for doctors are referral letter. But that does not mean you cannot have a transfer letter, you cannot have a discharge letter, but most of the time you have referral letters. But it's good for you to learn how to write both a referral letter, transfer letter, and discharge letters. I think that will be all for today. Thank you very much, guys. I so much love you guys. I'm always available to help you. If you have any question anytime, always contact me, and if it's within my power, I will help you out. The goal is for every one of us to pass this exam in one sitting. All right, guys. Thank you very much. Bye.